20. martā konferencē Veselība, izaugsmei tika apstiprināta rezolūcija, kurā Latvijas attīstība saistīta ar veselu un darbspējīgu cilvēku. Konferences mērķis bija akcentēt visu nozaru savstarpējās mijiedarbības nozīmi veselīgas sabiedrības, ekonomiskās izaugsmes un sociālās labklājības veicināšanā Latvijā. Konferences dalībnieku vidū bija gan premjerministrs Valdis Dombrovskis, gan Latvijas un Lietuvas veselības ministri, gan Pasaules veselības organizācijas Eiropas reģionālā biroja direktore Zuzana Jakaba.
I would like to say that we have good opportunity to discuss public health issues on such conferences which are on very high political level. Zuzana Jakab represents WHO organization, and she shows a report on European level, on global level, how is important to work together in cooperation, country with country, and especially Lithuania and Latvia. We are neighbors, and for us it's very important to look from which instruments we must develop our cooperation in cross-border cooperation and also in public health issues. Of course, conference is excellent organized, and rapporteurs are very well known, are prominent rapporteurs, and of course, Prime Minister who addressed very nice idea about possibility to support public health politics in strategical policy, health policy through health in all sectors, through cooperation in all government. It's a very nice idea. Cooperation in health policy in all three Baltic countries has a long story. Today we are on the stage when we signed tripartite agreement between Estonia, Latvia and Lithuania on cooperation which include common cross-border cooperation in emergency medicine, of course include possibilities to exchange our views on issues like transplantation, and of course to have possibility to buy some medicine together, all three Baltic states. I would like to say that from 2014 all our agreements will be in improving and in real life.
Hello, I'm happy to be here in Riga on the first day of spring for this conference, and I would just like to say how much I appreciate the invitation of the Ministry of Health to join the conference, which is talking about the future of healthcare and the economy in Latvia as we go to the year 2020. I think Latvia, because of how it responded to the economic crisis in the health sector, has put itself in a very good strategic position to move forward with health. It was a very difficult time period, but the country made a lot of good strategic choices that in the future should free up funds to be able to do an even better job in health. And I think there are two main areas which in fact the minister mentioned this morning. First of all, how to spend money more effectively to combat cardiovascular disease, which is the major killer in Latvia that really differentiates Latvia from the older states in the European Union. And this is a disease that affects men primarily in their working ages, so it's a real important question for productivity and for economic growth. So how can Latvia spend the money it spends today even more effectively to combat cardiovascular disease? And as additional funds become available as the economy improves, how can new funds be spent to make sure this that Latvia has success and starts to see mortality fall from cardiovascular disease. The second thing is how to buy down some of the very high out-of-pocket spending that Latvians endure in the health sector. And I think the development of the emergency social safety net during the crisis puts Latvia in a very good position to start to respond more effectively to this problem. It has targeted additional resources to the poor, and because it now has that mechanism, it should be pretty easy, fairly straightforward at least from a technical standpoint, to put additional funds into safety net targeted assistance that would allow people to have better access to the medical care system. So these, to me, are the two major strategic issues that Latvia faces in the next couple of years. And because of the decisions made during the economic, let's call it what it was, the economic disaster, the Ministry of Health has put itself in a very good position to be able to act on them. And I would hope that if I come back in the year 2020, we can see a lot of progress in improving, reducing mortality due to cardiovascular disease, especially among men and of course women, but it's really a major problem for men in Latvia before age 65. And secondly, that we see much reduced out-of-pocket spending by people who are least able to do so. Those are the messages I'm giving today, and I really appreciate the opportunity to do so. And I appreciate the opportunity to work with such an extremely competent set of people as I have in the health sector in Latvia for the last 4 years. Thanks.